All right, I'm going to stay on that issue of the federal government tracking financial transactions of conservatives. Religious texts, I mean, this is outrageous. It's a violation of our civil rights. But again, it comes down to elections. You've got Congress holding hearings, but the executive branch, as we've seen, they're going to do whatever they want to do. And oftentimes they know it's illegal. They know that if they go to court, they'll be in trouble, but the court system takes forever. And in the meantime, they'll trample on the freedoms of Americans. So we're going to stay on that. Also going to stay on the border, so text the word border to 67742 to sign the petition. All right, I hate to give you a lot of outrage today, but I just want to keep you informed of what's going on. And there's another disturbing event, development, I should say, from the World Health Organization. Now, this is it consists of about 8,000 health bureaucrats, 8,000 within the WHO. And the Director General is recommending the organization enter into a partnership with the pro-abortion Center for Reproductive Rights. Now, for 30 years, this Center for Reproductive Rights has worked to undermine the laws of sovereign states protecting children in the womb and subvert human rights laws. Now, granting the Center for Reproductive Rights official status within the WHO framework would run counter to the principles of the WHO. Not that they really care. But the bottom line is this puts them at the tip of the spear in terms of advancing the left's global ideological war. And what goes international comes back here. And joining me now to discuss this, Travis Weber, Vice President of Policy and Government Affairs here at the Family Research Council. Travis, welcome back to Washington Watch.
Thank you, Tony.
Now, I know folks, we're always talking about the WHO, but I will tell you, they are stepping up their activity because, as I said earlier in the program, they literally are at the tip of the spear of the globalization effort that is taking place. Today, we're finalizing a comment on the WHO and their pandemic accord. This is actually something else. Explain what's going on.
Yeah, no, you're right that they're at the tip of they're at the tip of the spear. They seem to be the ones really pushing right now aggressively with an ideological bent, right, under the guise of healthcare. Even this partnership that's been proposed between the Center for Reproductive Rights, it's supposedly to work on healthcare, but they're talking about taking the life of innocent children in the womb, and they're calling that healthcare. It's shameful. We're not going to see any pro-life organizations likely being welcomed into such a partnership with the WHO, and that just exposes the incredible hypocrisy and one-sidedness of this, despite the WHO's own guidelines calling for neutrality and impartiality to protect the integrity of its public health mission as a world health entity. And so it's very egregious.
They sidestep that by calling abortion health care. And so it's an essential, in fact, we've seen the WHO say this, that it's essential health care. They demanded that during the pandemic. It's a part of the pandemic accord to make sure that abortion remains accessible when everything else is shut down. But the Center for Reproductive Rights actually goes beyond abortion to advocate for other favorites of the left.
Yeah, no, Tony, it does. I mean, we're going to see a panoply of ideologically driven positions on matters which are ultimately matters of worldview. We're going to see the WHO take a view on the family, on sexuality. It's not going to be God's view when partnering with an entity like the Center for Reproductive Rights. Not only that, the Center for Reproductive Rights admits in their own internal strategy document that Congressman Chris Smith entered into public record, they admit to trying to subvert the laws of sovereign nations for the purpose of a worldwide abortion agenda. So in their own words, they're admitting we want to impose this on the world.
So this is part of the strategy. You go to a global entity, the World Health Organization, an arm of the United Nations, and under what they're pursuing under their pandemic accord, they want to have global power. So this is perfect for the Center for Reproductive Rights. They will be in the driver's seat of undermining the laws of so many countries that protect the unborn.
That's exactly right. And it's unfortunate that, people, the unfortunate thing is because this is presented in the name of healthcare, unless people do the digging, they're not going to see how egregious this is and how it's actually not healthcare. I mean, what we're seeing is the killing of the unborn going on in the name of healthcare. And so that's what, Tony, that's why we at FRC, we're trying to dig into this hole and uncover the really it's this garbage that's going on in the name of World Health using our tax dollars. We're seeing ideologies being pushed on the people of the world who are expecting their governments to protect them. You
mentioned tax dollars. We are the largest funder of the World Health Organization. That is the United States. I think it's 700 billion. I'm not sure what the number is, but I know we're the largest funder of the World Health Organization. All right, Travis, out of time for today. Thanks so much for joining us. Always great to talk with you.
Thank you.